as redundant abdominal skin.
This seems like a young patient, very young patient.
Very young. She's in her late 20s.
Late 20s.
Right.
So the abdomen, there's just no way to get rid of that.
No.
Except for surgery.
Exactly. I mean, you can work, you can do sit-ups and abdominal exercises, and yes, that will strengthen your abdominal wall, but nothing will happen. That skin is going to be there until it's removed surgically. And these are her post-operative pictures.
Wow.
We addressed the breast asymmetry with a lift on one side.
Huge difference.
Gave her implants and did an extended abdominoplasty, and it's night and day.
So tummy tuck, breast lift,
and breast augmentation. Randy, what you have to remember is that these patients have been heavy for most of their lives. They've never gotten to wear the clothes they wanted or participate in the activities that they wanted to because they felt uncomfortable about their appearance. After they have their weight loss surgery, yes, they're healthier, but they're still faced with the same challenges. Once they have some of these cosmetic surgical procedures, which in some ways are reconstructive procedures, if you want to look at it in its purest sense, they're able to do all those things that they wanted to do.
I mean, you can see this gal sitting on the side of a pool, probably showing off her abs.
Finally, and feeling a little bit more comfortable about it. And that's where I get my satisfaction from, hearing things like that from my patients, and I do hear those things.
And these are the kind of things where people say, boy, I should have done this earlier.
Absolutely, absolutely.
Now we have your patient coming on, so we're kind of crunched for time here, so we have time for a couple more photos.
Okay, this patient here was a 33-year-old female, had a bypass, lost a lot of weight. I show these pictures here because in addition to having
what a difference.
Her surgeries for her excess skin issues, she also had some cosmetic dentistry done by a friend of ours, Dr. Gulpa.
Dr. Gulpa, yeah.
Right, and this is a picture of her, before she had her weight loss surgery, and this is a picture of her here after her weight loss surgery and her cosmetic surgery.
So what did you do for her?
She
had tummy tuck, lipo,
a tummy tuck, abdominoplasty, breast lift, breast augmentation. I mean,
unrecognizable.
She looks like a star. If you
she does. She looks like some kind of.
Randy, if you have time for one more, I'd really like to show you these. This is really interesting because this is actually a couple, a husband and wife, who were heavy. Both had their gastric bypass procedures at around the same time, lost all their weight, and then they took turns having their cosmetic surgery with me. This is a photo of them before their surgical procedures, either their bypass or their cosmetic surgery procedures, and this is a photo of them both afterwards. And look at the dramatic difference in these pictures. Much happier.
What do they say? I mean, do they thank you? They hug you? What do they say? I mean, because
by far, this is the most grateful patient group that I deal with. The impact is obvious. The quality of life improvements are evident, and it just makes me feel good about what I do and happy that I can do it.
And people are traveling to see you. Is that right?
I get patients from all over the country and some patients from Canada as well.
I get asked all the time, plastic surgeons that don't want to do it, and I told them about you. And so they're going to be sending those patients to you.
Thank you.
Now, we're going to meet your patient in a second. Jay.
Jay
He lost 155 pounds.
Right.
And tell us about Jay. What are we going to hear from Jay?
Jay was the patient whose photos you saw earlier on in the interview. He's a guy, he's a graphic artist, knocked around from doctor to doctor's office and finally happened upon me in my practice. And he was frustrated. He said, Dr. Stile, these doctors just don't get it. They don't understand the issues that I face. They don't understand how it feels to be me, or a patient like me that's lost all this weight and now has these new challenges that limit my life. Can you help me? Basically, that was it. Can you help me? And we talked for some time. I got to know him a little bit better. I wanted to make sure that he was realistic and that he was motivated, and he was. We took a chance on each other, and things worked out great. Okay,
we're going to take that break, and when we come back, we'll have him right here. Great. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, you're going to meet a patient that had the surgery, and let's hear what he has to say. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Frank Stile, board-certified plastic surgeon, with his patient, Jay, who lost over 150 pounds and had cosmetic surgery after massive weight loss. Jay, I want to thank you for coming on the show and sharing your story. And so we'll start with how you heard about Dr. Stile.
I heard from Dr. Stile through a friend of mine after I've seen several other surgeons, and I got a consult, sat down with Dr. Stile, and then I realized that he was actually the doctor I wanted to have my surgery with.
Okay, now you knew right away, you told me. We
Yes.
talked yesterday. How is he different than the other doctors?
Well, he treated me like a real human being, and I wasn't just a patient. He realized that I was going through some struggles.
Expand on that, by the way. I mean, so you're in a consult with another doctor. You said it was more like just a patient.
Yeah, they just looked at me, basically told me what they could do, told me what the price was, and basically that was it. Dr. Stile realized the journey I was traveling. I realized, I wanted to finish it, and he seemed really interested in helping me do
So
that.
he listened? I mean, that was really the only difference. He just listened to you.
Well, the listening, the care, his staff, the way they treated me,
Okay.
it just seemed a lot more warm and fuzzy feeling.
Okay, so on the consult, you came in. What was your problem? In fact, let's take a look at your picture right there. I mean, you were pretty heavy there.
Yeah, I was 360 pounds there. I was heavy all my life. I was almost 11 pounds when I was born, so it's something I've had to deal with my entire life. And now through technology, through gastric bypass, which is what I had, I'm finally at a point where now I can look thin and be normal.
Yeah, you look. I told you I've seen you in. You showed me your stomach yesterday. I mean, he looks great. I mean, was he an easy patient, typical patient?
He wasn't. There's nothing easy about it, and there's once again there really is no typical patient, but he had some of the typical issues and challenges that this patient population presents with. Here's a guy lost a lot of weight, 155 pounds to be exact, was thinner, healthier, but had this huge issue with redundant or extra skin, and it was almost hanging down to his upper thighs.
Let's take a look at that.
And here's a picture of that he took himself.
So you reached your goal, your whole life, you worked toward this, and now you have this saggy skin. How did it make you feel?
Well, I realized at that point that every time I looked in the mirror, I was still heavy. I couldn't put my shirt in my pants. I still had to pull it out to hide the roll. It was still there when I would try to sit in like tighter seats, whatever. So I lost all the weight. I was doing ab crunches and everything, but it wasn't changing it. The only thing that was going to change this and give me the body I always wanted was to have plastic surgery.
So, Dr. Stile, I mean, this overhang, is that common for people that are losing this kind of weight?
Very common, very typical.
There's no way to get rid of that other than
you
surgery?
can do sit-ups, and you can run on a treadmill for a year, and that's not going to go
So what's
anywhere.
in there? It's just skin, or is it
It's
fat
just
and
extra skin and a small amount of residual fat. The amount of fat and amount of skin varies from patient to patient, but the issue is the same.
Okay, so with him, what did you do? I mean, what kind of procedure?
Well, what we did was what I like to call an extended abdominoplasty, and what that basically means is it doesn't go from iliac crest to iliac crest or hip to hip. It goes around, almost meeting in the back.
Oh, really?
So I can get some of that skin out from the lower flanks and give a small degree of lift to the gluteal region as well. We did a little bit of liposuction in the lower back as well, just to give them a finished off contour. But it was one of the larger segments of skin that I've ever resected in my career.
Really? I mean, how much? Showing with your hand.
It was pretty big. I mean, from tip.
Really?
Yeah, pretty much about 3.5 feet. And
what do you do with that skin?
We actually donate the skin to a cancer reconstruction program or burn center where they actually purify the skin and use it for patients either temporarily or permanently who have defects. So none of this goes to waste.
Now you say that you're involved online, I guess networking with other weight loss patients.
I talk to weight loss patients all around the United States and around the world. I also go to support groups locally. And and we all talk about the same issues and have the same problems.
And what are the main issues? Just the laxity of skin after the weight loss?
Yeah, after 2 to 3 years after you have weight loss surgery, you're going to need plastic surgery. It's just a fact that most people have. Women have different issues than men, but it's something that most of us come down to realizing this is something we have to do.
Now, when you were in with the doctor that did the surgery, did he ever tell you, hey, you lose 100 pounds later, 150 pounds, you may have to have some surgery?
No, they never told me that. I found through research online and stuff that a lot of people did. I actually thought I wasn't going to need it. But as I started losing weight quicker and quicker, this little shape wasn't going away. And when I got down to my goal weight, it was still there.
So what about now? How are things different? I mean, now that you got rid of that.
Well, I feel great. I can actually wear clothes now. I can tuck my shirt in. Exercising is a big plus for me now. I can actually go running, and I don't feel my stomach jiggling in my way.
That's a good point. Okay, so you really can't run with this before.
No, and I was actually having muscle spasms because of the overhang of the skin. So now because that's gone, it's changed my life. I feel better. I think I look better, and it's helped my self-confidence also.
People treat you differently? I mean, you were a big guy, 360 pounds?
360.
I mean, do you notice? I mean, do you feel it that they're treating you differently?
Unfortunately, yes. People do have a little bit of an attitude when someone is larger. They think they're lazy or whatever, and it's not the case. But now that I'm a lot thinner, most people don't realize I was heavy, and they do treat me different.
Okay, Dr. Stile, how soon can, in an ideal situation, can somebody go back to work after this surgery?
You can go back to your, what I like to call activities of daily living, which is taking care of yourself, taking care of your personal errands around your house, and even driving. Or if you have a sedentary job that doesn't require heavy lifting or a lot of activity, 2 to 3 weeks. But back to full activity, usually 4 to 6 weeks, including exercise.
Now, what about downtime and pain, things like that? Is that something to be afraid of?
No, actually, the plastic surgery was a lot less than the gastric bypass surgery.
Really?
Yes.
I don't hear that. Okay.
The first couple hours, especially of gastric bypass surgery, is pretty painful. They make you walk as soon as you get it. So that way it helps with gas and everything else. But the plastic surgery didn't really hurt that much. I was really surprised by the amount of pain I didn't have.
How soon were you back?
I was back to work after 2 weeks.
2 weeks. Okay, even though he told you 3 weeks, you went a couple...
Well, I sit down at a desk all day. So
could you have worked earlier if you wanted to? I mean,
possibly if I wanted to. I'm glad I took the 2 weeks, but I was definitely ready to go back after 2 weeks.
What else can patients expect after the surgery?
They're surprised that they see their results instantly. When they have their bypasses, the changes are slow and happen over the course of 12 to 16 months or 18 months, a year and a half, 2 years. But with the cosmetic surgical procedures, once they wake up, it's gone. He was a different guy, and he was quite amazed to find that it was gone. I mean, the changes were made, and the only thing he had to wait for was for the healing to take place. They have a small amount of discomfort. It's usually managed with oral pain medication, and we follow them closely. We see them many times during the course of their first month in their postoperative period, and then we follow them up for the whole first year. We help them with plugging them into support groups, nutritional and exercise counseling, which we offer the resources for that as well.
Your program is comprehensive? I mean, you put it all together for them?
It is comprehensive. From the moment they walk in the door and express an interest in this type of service, we sit down with them, put together a realistic game plan with realistic goals with respect to time and what their priorities are. We stage the surgical procedures if they need more than one, if it requires more time than we'd like to do at one sitting, and make sure that what we do doesn't really interfere with their jobs and their quality of life outside of the surgery. We take care of them with respect to plugging them into nutritional support, exercise and training after this, and support groups as well. Part of our Jay's experience was so good that he was very passionate. He was very passionate about this, and basically said, "Hey, let's put a program together that can offer all this to people like me."
Is that right? So you want to help? I mean, you want to help others. I mean, that's the reason you came on the show. You said.
Exactly. We created this program for weight loss patients because I want to help them create and end their journey like I did mine. I want them to have the body they always wanted. Actually, like one thing Frank talked to me as soon as surgery was over is he came in and we were talking about the instant gratification. He said, "What do you think?" And I was looking down going, I can't believe this is my body.
Really?
With weight loss surgery, you're losing 2 to 3 pounds a day. Here, after 4 hours of surgery, it's just gone.
How much weight, by the way, after the surgery did you lose?
It took 12 pounds off me.
12 pounds. Did you cut out about 12 pounds, or he just lost?
It was about 8 or 9, and he lost a little bit more afterwards.
Did this give you leverage to take it to the next level? You're at a bit of a plateau there. I mean, do you feel like it gave you the leverage to start exercising more, eating better?
Oh, definitely. The exercise part specifically because of the fact that the skin was in the way.
Now, you have a website.
Yeah, we have a website. It's called niptuckme.com, and it's for patients to go online.
It's yours.
It's my site that I created with Dr. Stile as our program. They can go online. They'll see pictures of the facility. They'll see pictures of Dr. Stile. They'll see before and after pictures of me of weight loss and plastic surgery.
So your mission, by the way, is twofold: to get people that are overweight like you to get either lap band or gastric bypass, and then to get the cosmetic surgery afterwards? Or is your mission more toward the people that have this overhang, this huge loose skin?
Well, for the people who never had weight loss surgery who are thinking about it, it's definitely something you should do. And for people who have lost all the weight and they're still not happy with what they look like, it's something you definitely need to do. It was the best money I ever spent.
Really?
Yes.
So you would do it all over again?
Oh, I do it in a heartbeat. And then luckily I met Dr. Stile, who I
Abdominoplasty.
Very nice.
This next patient here is in her 30s and lost a significant amount of weight and required both a breast lift and an abdominoplasty as well as some liposuction.
Boy,
she
that,
got
you know,
all of that.
these abs are just cleaned right up. No overhang at all. Very
And
nice.
once again, look at the difference in choice of undergarments, the colors,
Huge
much brighter.
difference.
Right. This patient here had a bypass procedure